It's a great honor for me to be here at the Empire Club of Canada today, which is arguably the most famous and historically relevant speakers podium to have ever existed in Canada. It has offered its podium to such international luminaries as Winston Churchill, Ronald Reagan, Audrey Hepburn, the Dalai Lama, Indira Gandhi, and closer to home, from Pierre Trudeau to Justin Trudeau. Literally generations of our great nation's leaders, alongside with those of the world's top international diplomats, heads of state, and business and thought leaders.
It is a real honor and a distinct privilege to be invited to speak to the Empire Club of Canada, which has been welcoming international diplomats, leaders in business and in science and in politics. And when they stand at that podium, they speak not only to the entire country, but they can speak to the entire world.
Good afternoon, fellow directors, past presidents, members, and guests. Welcome to the 117th season of the Empire Club of Canada. My name is Antoinette Timilo. I'm the president of the Empire Club of Canada and your host for today's virtual event on vaccine hesitancy, convincing Canadians of the importance of vaccines, featuring Angela Chu, Dr. Jia Hu, Raj Pannu, Scott Ratzan, and our moderator, Bill Powers. Before we get started, I want to take a moment to recognize our sponsors who generously support the Empire Club and make these events possible. Thank you to our lead event sponsor, GSK, and to our supporting sponsor, University of Calgary, O'Brien Institute for Public Health. I also want to thank our season sponsors, the Canadian Bankers Association and Waste Connections of Canada, and our event partner, BBC and livemeeting.ca, for webcasting today's event. Now for a few logistical items. If you're finding your internet feed is slow, please see below and click the Switch Streams button. And if you're experiencing technical difficulties, our team will be happy to assist you. Just press the Request for Help button that's available to you. I just want to let everybody know that this is a very important discussion today, so our event will be just a little longer. Our typical events run till 1 p.m. This one will go 15 minutes over. So hang in there, because there's going to be lots of interesting questions and discussion. So it's now my pleasure to call this virtual meeting to order. We've all been living in a pandemic for the last year. This has upended our economy and continues to pose a severe threat to public health. As our municipal, provincial, and federal governments have responded to the pandemic, we are now trying to achieve herd immunity from COVID-19 with vaccinations. We live in a digital age where social media drives new narratives and misinformation at an alarming rate. Our panel today will look closely at the level of confidence Canadians have in vaccinations and will discuss in detail how we can help combat fake news and anti-vaccination misinformation. It is now my pleasure to introduce our lead sponsor from GSK, Faris El-Rafai, President and General Manager of Pharmaceuticals, to say a few words and kick off the event.
Thank you, Antoinette, and welcome everyone. In our current environment, vaccination is a hot topic around where there's much debate, from sourcing, developing, and producing to availability and uptake. What's clear, though, is solutions to Canada's vaccination challenges will require innovative thinking and ongoing collaboration across all of our stakeholder groups. At GSK, our foremost contribution in the fight against COVID-19 is using our science to develop solutions. Since the pandemic began, we've been seeking ways to harness our scientific expertise and technology to make a difference. We're collaborating with several organizations working on promising vaccines in combination with our adjuvant technology, including Sanofi and Medicago here locally in Canada. And most recently with CureVac, developing innovative multivariant vaccines. Alongside our work to develop adjuvanted COVID-19 vaccines, we're continuing to work hard to find other ways to help tackle the pandemic, including exploring potential therapeutic or treatment options for patients suffering from COVID. While the pandemic has brought vaccine-related discussions to the forefront, as a leader in vaccines, GSK is active in the fight against diseases on a daily basis. We have a portfolio of more than 30 vaccines for every stage of life, helping to protect Canadians against more than 20 diseases. And we also have a robust pipeline of 15 candidate vaccines in development as I speak. For GSK, innovation is the beating heart of our business and, quite frankly, our industry. Without it, there would be no new vaccines for the many diseases that still threaten individuals, families, and communities, not just in Canada, but around the world. Our approach is to make the most of our own expertise and experience while at the same time forming complementary partnerships and alliances with others who bring different kinds of technical and scientific expertise and also approaches to vaccine education to tackle public health challenges around the world. And there are many challenges to be tackled. The success of vaccines and vaccination programs means that many people no longer see diseases that used to be common and may have forgotten how potentially devastating they may be. Across the world, vaccination is recognized as one of the best investments that any government or healthcare organization can make. And we've seen the positive impact vaccination can have. 100 years ago, infectious diseases were the leading cause of death worldwide. In Canada, they now cause less than 5% of all deaths, thanks in part to immunization programs across the country. But the current pandemic has put those gains at risk. There have been reports of up to 50% decline in routine immunizations over the past year. The avoidable suffering and potential death caused by individuals missing out on routine and recommended immunizations could be far greater than that of COVID-19 alone. A lower uptake of vaccination and reduced coverage could mean the return of diseases which have previously almost disappeared and whose impact on health has been all but forgotten. As we wait for mass vaccination against COVID-19, it's important to remember that there are diseases that we can take action on to help prevent now across all age groups through immunization. Further, the WHO has declared vaccine hesitancy, the reluctance or refusal to vaccinate despite the availability of vaccines, as a global health threat that could reverse progress made in tackling vaccine-preventable diseases such as measles, mumps, and meningitis. What makes vaccine hesitancy a particular challenge is its complexity. It's often context-specific, varying across time, place, and vaccines, and it can be influenced by factors such as complacency, convenience, and confidence. So along with you, I really look forward to hearing what today's panelists will share as we explore this important and timely health threat. So without further ado, I'll turn it over to today's moderator, Bill Powers, to introduce the panelists and get the discussion started. Thank you for giving me the time and the opportunity to open today.
Thank you, Ferris, and thank you all for joining us today. We have a really distinguished panel, and I'm honored to be moderating. I come from a background in journalism originally, and then thanks to a book I wrote a decade ago, I got involved in the technology world as a scientist at MIT. And I'm now co-founder and CEO of a startup that's all about using social media, viewing social media not just as a problem today with the issues that Antoinette mentioned about misinformation and false narratives, but also as an opportunity to hear people's voices in public opinion more clearly. It's called becausehumanity.org. So this COVID has been a challenge and a puzzle for every country and for the world since the start. We've never been here before, in a sense, because the world is so different from the last pandemic in 1918. And the vaccine is the newest challenge, of course, and the newest puzzle. And though every country is facing somewhat different challenges, the topic we're talking about today, vaccine hesitancy, is present everywhere to some degree, as we'll see from my panelist colleague Raj's presentation in a moment. And that's why we're here, to try and work on this question, discuss it, see if we can make some progress and get some new insights and answers on where we're headed. And I would just add that I'm in Massachusetts. I live in Massachusetts, and one of the big surprise here in the vaccines is that despite our amazing medical and public health and pharma and biotech establishment, the state of Massachusetts is doing a pretty lousy job with the vaccines, and we didn't see that coming. So we're wrestling with that here, and I know you're wrestling with your own challenges in Canada, and I'm fascinated to hear what everybody has to say and learn from it. So to introduce our panel, first we have Angel Chu, who is Vice Chair of Immunize Canada, and also an infectious disease physician in the Department of Medicine at Foothills Medical Center. Thank you, Angel, for being here. Jia Hu is a medical officer of health at Alberta Health Services. He's also the chair of 19 to 0, which is a coalition of academics, public health experts, and others working to shift public perceptions around COVID-19 behaviors and vaccination. And my organization is a partner, as is Raj's, who will be speaking in a moment. Raj Pannu is CEO and founder of Emergence Creative, which is a global advertising, marketing, and communications agency. And Scott Ratzan is a distinguished lecturer at City University of New York Graduate School of Public Health and Public Policy. Thank you all for being here. We'll have a good conversation, I know. And I will hand it now to Raj for his presentation on the polling results about vaccine hesitancy. Raj, over to you.
Thank you so much, Bill, and thanks to the Empire Club and GSK and the O'Brien Institute for hosting what I think is a really, really important discussion. So, hi, I'm in New York City, where we are experiencing decidedly Canadian weather, I would say. Certainly not weather to go oot in a boot in, as they say in Canada. I'm allowed to say that because I'm Canadian. But I do think this is a really critical moment for vaccines. And I just kind of want to reiterate what Ferris said to begin with, which is it's a pivotal moment in public health. Our philosophy at 19 to 0 is really that vaccines in and of themselves don't save lives. Vaccination saves lives. And, you know, as Bill mentioned, you know, in Massachusetts, they're having problems rolling it out. Obviously, Canada is experiencing its own challenges on the logistical side, both in manufacturing and getting the vaccines out to people. But getting the demand side of vaccination is a sort of a really important and not often discussed issue. And I think, you know, the reasons for that are that there's so many, you know, I think there is a certain kind of, I wouldn't say arrogance, but I would say, you know, just it's one of those things that people, you know, assume that, you know, if we rush and we create wonderful medicines, that for some reason everybody will take them. And we know, certainly on the behavior change side, that is not the case. And you know, this moment is so huge. It's a pivotal moment for vaccination, similar to, you know, polio and smallpox historically. And I think success with COVID-19 vaccination and getting rid of this disease, a scourge that is causing like such a massive social, economic, political crisis in the world, is going to be a huge step forward for vaccination. I think there will be very little to demonize vaccination if this effort ultimately succeeds. And of course, it's also a dangerous moment because if we, as Bill said, if we have problems either getting this thing out, or if these new and potentially dangerous variants begin to take over, and the vaccinations for whatever reason prove less than successful, then, you know, we're going to have future problems. So I think it's both an opportunity, but it's also a very dangerous moment as well. So as we think about what we're doing, 19 to 0, Bill said, we're essentially a coalition of sort of a multi-sectoral coalition of scientific, public health, and behavior change experts, and we're working in a very, very sort of multimodal way to address the issue, the demand side issue of vaccination, and that's everything from public relations, so doing events, for example, like this, or going out to the Canadian media to talk about vaccination and making sure that people are both compliant with COVID behaviors, as well as try to reassure people about the data around vaccination. We're also collecting a lot of data around perception, and that's in the yellow box there. We're doing it both by looking in many ways at social media, and Bill and Jack can talk a little bit about that, but also looking, doing focus groups and polling, to really get a sense of what Canadians are thinking, and then doing a lot of engagement. So we are running national television ads. We're doing, social media types of campaigns, as well as engagement with different target groups of vulnerable populations, for example, or healthcare workers, to really try to, work across the country for all Canadians to make sure that vaccination happens, so that we can move past this crisis. In terms of public perception, it's really interesting. Obviously, if we look sort of longitudinally from last summer to, now, what we see from a perception standpoint is that, initially through the fall, we saw a sort of decrease in confidence around vaccination. And then there has been a slight uptick in the last, few months, obviously, as the vaccines have begun to roll out. But the fact is that overall, the enthusiasm is actually unacceptably low. There are 40% of Canadians approximately who are either unsure or unwilling to take the vaccine. That is not acceptable. That is a very dangerous situation, and that is precisely what we're trying to really deal with. And as Scott will tell you, this is not just something that's happening here. This is something that's happening all over the world. And perhaps a little even more disturbing is the fact that if we look at healthcare workers are not any different from the normal population. One would assume, I think, that healthcare workers, just because they understand, the science of vaccination, would be, have a much higher confidence in vaccination, but that is not the case. Essentially, if you look at healthcare workers, their confidence in vaccination is roughly the same as the general population. So what does this mean? When we think about COVID, one of the things that gets tossed around is this idea of herd immunity or community immunity, where essentially you have enough people in a population that are immunized against the virus, so that it sort of protects those who are not. And in order to get to that stage, you've heard Dr. Fauci in the U.S. government talk about, somewhere between 70 and 85% of the country, those who can get vaccinated, need to get vaccinated to reach this level. So what does that mean, given the confidence that we've seen in Canada? What we're seeing is there's a gap. There's a gap between the people who, what we need to achieve, and the number of people who actually currently want to get vaccinated. And that is a very critical, and that gap could be anywhere between 7 and 10 million Canadians who are, are reluctant to get vaccinated. That's a huge issue. It's extremely critical that we reach these people, that we convince them, so that we can, because the entire country in many ways depends on this. So when we look, there have been multiple studies that both we've done and others have done in Canada looking at vaccine confidence. And what's really critical is, no matter what study has been done, what we've seen is that there are, a very large number of people, what we call the movable middle. That is, there are people who are definitely not going to get the vaccine, and there are a number of people who definitely will, and many, some of whom have received the vaccine. And then there's this group who are uncertain. And these, I think, are the critical targets, both for campaigning and engagement. They're called the movable middle because they are not adamantly opposed to getting the vaccine, but they have concerns, either legitimate or not. And we'll talk in detail about that, what are the sort of psychology and, of these populations. But they have concerns, and those concerns need to be addressed so that we can, move in the right direction. One of the things we found, and this is really interesting, and this is like part of our work, is that you can do a very, very deep segmentation analysis among these groups, and you can sort of figure out there are predictable ways of influencing people and I'm speaking now as an advertising person, predictable ways, sort of psychological and psychographic and demographic sort of targeting of people, presenting, I think, in the sort of traditional axiom of advertising, which is with the right message to the right person at the right time, in order to achieve success with the movable middle. And what's really interesting is, of the people who are really, really opposed to getting the vaccine, there are within that population people who are on some level concerned about the danger of the virus. So we have worked with Angus Reid, the polling company in Canada, to create something what we call the concern index. And what we found actually is that for people who are concerned, the more concern that you have about the virus, the more likely you are to, subscribe to what we call positive COVID behaviors, whether that's social distancing, whether that's masking, and all of these other things that are critical behaviorally. So part of the sort of strategic framework that we're thinking about is how do we, make sure that people who are potentially, movable, and if we can increase the concern level about this virus, it's very likely that we can shift people over to, being confident about the vaccine, as well as making the right sort of personal decisions around behavior. And lastly, one of the things that we've done, which is really interesting, and we can talk about a little bit later on, is in terms of campaigns, we have actually launched a campaign pilot in Alberta. And what we've seen is even among people who are unconcerned, and we have various archetypes of these types of people that we've developed. They are reachable in some ways if we present them with the right message in the right way that sort of makes them that doesn't talk down to them, that speaks to them and their lived experience. We can get them to be engaged on the issue of vaccines and not dismiss it outright. And I think that's really interesting, that there are actual tangible opportunities to have impact. And this is precisely why we started 19 to 0 in the beginning. And I think as a group, all of us feel this is something that we must do. So I think with that, I think that's a good foundation for this discussion. And thanks. Over to you, Bill. And I'm looking forward to discussing this further.
Thanks very much, Raj. Fascinating, great information. So before I throw out the first question to our panel, I want to emphasize that the audience can also, this is an interactive event, and we'd like you to participate. And you can do that by submitting your own questions. And I believe you can see on your screen on the right-hand side a question box. That's the way to do it. And we're hoping to use at least a few of those questions before the end of our time together. So please fire away with questions and we'll go through them all. As we saw, this is for the panel now, my first question for the panel. As we saw in the presentation that Raj just gave us, 60% of Canadians would not get the vaccine as soon as it's available. We know that in order to achieve herd immunity, we will need close to 85% or higher uptake from Canadians. Why do we think so many Canadians are hesitant about taking the COVID-19 vaccine? I think that is a question that everyone on our panel would have something to say to, and I wonder, Angel, if I could start with you first. Do you have any thoughts on that?
Sure, yes, it's a pleasure, yes. Thank you very much for that very insightful presentation, Raj, and I would echo the same kind of messages that Raj and Ferris had spoken to earlier, where, vaccine hesitancy is such a complicated issue, and, what it really boils down to from the public's perspective is that vaccine hesitancy really has emotional and social roots to it, whereas in medicine, we oftentimes talk about science and data and evidence and facts, whereas to the patient and to the public, it's more of an emotional aspect and more of a social context. So they've heard stories about, the conspiracy theories. They've heard falsities about vaccines and the negative things that vaccines do, and so they're touched by that. Whereas, when we get down to the whole heart of vaccine hesitancy across all vaccines, not just with COVID vaccines, where patients are skeptical or they may not not be certain about a vaccine's effectiveness, whether vaccines are safe or needed, especially with COVID vaccines, where the timelines in development have been so accelerated compared to other vaccines. So there's a lot of concern and skepticism around the safety and evaluation of these new vaccines and what long-term side effects, if any, there will be. And also, I think there's questions and uncertainty about whether or not vaccines are necessary and whether or not there are reasonable alternatives. And I think we would all agree that living in all these restrictions and lockdowns is not sustainable in the future. So there's many, many complicated issues and complexities as to why Canadians are hesitant. But we know that it's not just a problem in Canada, it's a global threat where vaccine hesitancy really is one of the biggest threats to public health initiatives. And we have to do better as a society, not only in talking about that herd immunity, but community protection, and really emphasizing a consistent message that we all have to do our part and we all have a role in ensuring the safety and health of our communities and those around us.
Thank you very much, Angel. John, do you have any thoughts on this question of the hesitancy and what's driving it in Canada?
Yeah, no, for sure. And I think everything that Angel said was very accurate. I mean, I think that it's interesting. I think we say, healthcare providers, like doctors, like we deal in facts, but, we're like the general public. Like a lot of this is based on emotion and trust. I mean, I think trust is really, I don't want to sound reductionist, but really like a huge amount of our survey data shows that trust is a big underlying driver of whether or not people will get vaccine, right? And that includes trust in government, trust in Health Canada, trust in, the pharmaceutical companies. And so I think, that manifests as, I'm worried about the safety because I don't trust the regulatory process. And, if I layer on, Angel did mention something like the social context, right? There are groups that have maybe good reason historically to not trust institutions, and we see lower uptake in those groups. The only other thing I'll mention is that, right now we do see actually a high watermark in terms of willingness to take vaccine. But I think that is prone to change, right? We are likely to approve a vaccine very soon, the AstraZeneca one, and it won't be as good. And, I think that's probably going to decrease trust. And so it's not, you have the underlying drivers, but sort of like polling data, the number fluctuates. So it's not like we can just give up at any given time and say we're okay. So, yeah.
Great, thank you. Scott, how about you in your position as a public health and public policy expert? Do you have any thoughts on this question?
Well, thanks for the opportunity, Bill, and again, the Empire Club and addressing all of you today. I've been really looking at this for quite some time. I'm a public health physician with an expertise, shall I say, in health communication. I've been editing the Journal of Health Communication for 25 years. And before we started this initiative that we call CONVINCE, which stands for COVID-19 New Vaccine Information, Communication, and Education and Engagement, we had looked at a whole variety of activities over the last decades. I spent a year at Harvard Kennedy School looking very specifically at the vaccine hesitancy that was not related to COVID, but just in general, I think was mentioned earlier. There are fundamental issues, Jean mentioned very well, that are trust-oriented, as well as the fact that we don't have a trusted source that everybody can go to, whether it's the World Health Organization, in the US, the Centers for Disease Control, the European Centers for Disease Control, all these different groups, Royal Academies and so forth. We have not been able to create the Trusted Information Bureau on COVID-19. Now we have the opportunity with vaccination. We need to get at it. And we did do a 19-country survey on vaccine hesitancy, as well as the general population's belief or response to how they thought their government was doing. And let me just say it wasn't great. And part of it, I think, is that governments around the world were not prepared. And the kind of cooperation that we need is still lacking, if I can say that. So all in all, I think we have to think about the emotions. I think Raj did a great job. I like the idea of a concern index. And it's troubling, but yet doesn't surprise me for a moment to see the
35 or 3/4 of the population here that are listening know people that are hesitant about vaccinations. We need to address that by listening to why. It's not just giving them evidence, it's giving them an understanding. This whole idea that vaccines may be different by the manufacturer is a whole nother element that maybe we'll talk about later. But I think the bottom line is that all these vaccines have gone through rigorous scientific and medical evaluations and regulatory approvals. We need to communicate that well enough in a reasonable fashion to all business leaders. And then we need to think about how to move people. And the point that I often say is passion is the mover to action, but reason and the science is the guide. And that's what this is all about. And that's why we're working most closely with the business community. And I'll come back and talk about how our business community is the trusted source for many people. In fact, many more countries around the world than even government or others. So we need to work very closely with multiple sectors to do this. And I think we will be able to do it. But it is a test of our generation or maybe of our lifetimes.
Thank you, Scott. Raj, having heard those responses to your presentation, do you have any further thoughts? I was taken with that idea of passion and reason together and how that comes through, but it can be challenging.
It certainly can be challenging. It is kind of, but this is why the tradecraft of advertising is a powerful tool in this case, because obviously the failure in some ways of sort of traditional public health communications has been that they've been trying to sort of breach this trust gap that Scott was talking about with statistics and evidence, and to some degree that works, but that only is there's only a certain sort of highly educated group of people that are fully receptive to that kind of messaging. I think when you get into what Angel talked about, which is the more emotional messaging, where people, and this is not, this isn't disingenuous. I mean, the fact is that there are deeply emotional issues that are related to this virus. And it's not just the fact that, people are dying. It's a fact that people are losing livelihoods. It's a fact that people are not able to see their loved ones. I mean, there's so, not be able to educate their children. There's so many downstream effects that it's actually a very ripe area for storytelling, quite frankly, and to be able to make that emotional connection to get people to understand the impact of this virus and why it's such a scourge and why vaccination is so important to help us get there. So I do think this idea of segmentation, the fact that we were able to segment these groups and the fact that we were able to have success even within the most difficult groups, the people who are the most hesitant, we were able to engage. I think that tells you that there is an actual opportunity, and that opportunity is through communications. And so, I think what everybody says, I wholeheartly agree with, and actually think of this as a pivotal moment for, us as a country to engage with, those around us to, drive these messages forward.
Great, thank you. So before we move on to the next question, we have a poll question for the audience that we'd like everyone to participate in, if you're willing. And the poll can be found I believe on the right side of your screen. And this is for everybody watching. And the question is, do you have a family member, friend, or colleague who is hesitant about vaccinations? Is there someone who's in this hesitant group? Please respond, and we will offer up the results later in this event. So the next question for the panel is sort of a natural follow-on to the one we just discussed, which is how do we reach Canadians and educate them on how vital vaccines are for public health? And Ja, I wonder if you might start on that, sort of the how piece.
Yeah, definitely. So, I mean, I think for this COVID pandemic, we really need like a multi-channel approach. The way 19-0 works is we try to, hit Canadians at all levels, actually. And what do I mean by that, right? And so, as I said, like trust really is the underlying driver. I think it sounds sort of chintzy, but it's true. And so, traditionally, we work through healthcare workers, right? They are actually one of the most trusted groups in society. And there's lots of data that shows having a doctor or a nurse or a pharmacist recommend a vaccine will actually increase vaccine uptake. Prior to COVID vaccine hesitancy in these studies, that was the only thing that was actually proven to increase uptake of vaccine. But that's not good enough in my mind for this. Vaccine hesitancy has been a problem for a long time, but now it's very acute. And so we need to do things like the work that Raj and the marketing agencies do, right? Which is like data informed, like targeted campaigns that really don't just talk about, hey, get vaccinated, but like drive to the underlying reasons behind why people don't get vaccinated. Healthcare workers and a lot of healthcare workers, the data for December showed they wanted about as much as the general public, which is a little alarming. We want them vaccinated. We want them recommending it. Particularly salient, I think, to this call, though, is like, those are sort of what I call like some of the traditional approaches. But I think that we really do need a whole of society approach, right? Because you may, sure, trust your doctor, but you might also trust your employer. You might also trust your priest, your imam. And so we're working with many groups, schools, businesses, NGOs, municipalities, really everything, because you sort of want, like, the more people that say, hey, get the vaccine, like in a non-judgmental way, the better. And then the last piece is around the social media intervention. Again, no one's really ever figured out, I think, how to dispel misinformation on social media. Part of what we've done is like analyze everything, and that's good, right? Like that's a starting point. But we're working on creative solutions to actually deal with misinformation. That's something Will and his team and we work on together, right? And that, like, we're using vaccine, like this is right critical for COVID, but it extends into the political sphere too, right? As we know quite well. And so it really is that we got to try everything. And I think that the good thing about that is that, like, everybody has a role, right? And I think that agency helps, because I feel like so many people, like, not a doctor, not a public health person, feel pretty beaten down, but everybody does have a role, and I think that's quite empowering.
Thank you. Angel, do you have any thoughts on the how and the trust piece? How do we get that trust?
Yeah, so I would echo everything that Jha said. I think through the work that Raj and other organizations and marketing groups and survey groups have done, we really have to explore the reasons why people are hesitant. I mean, we have to acknowledge their concerns, their feelings, and explore the underlying reasons and really show that we care. I mean, from a healthcare perspective, as a physician, I think one of the principles that we always try to convey to our patients and the public is that we ultimately care about them. That's why we do the jobs that we do, and we have their best interest at heart. So if we are recommending something, then we need to have that consistent message, and it really has, again, to boil down to the patient's emotions. Once they understand and see that we in healthcare care about them, well, then that motivates them to do something else, to care about themselves and their communities as well. And I think other things that we can do is also to be more proactive rather than reactive. We know these vaccines have been here already. We have 2 Health Canada approved mRNA vaccines. There will be others that go through the approval process, establishing that trust, but to be more proactive and get out there and get the messaging out that these vaccines are important. And to use Roger's word, I love that word, this is a pivotal moment for society and for vaccines. And if we can capitalize on that and be more proactive rather than reactive when the vaccines come out and then deal with this issue, well, we can make a lot of ground and do a lot of good in the meantime before these vaccines come out and are widely available.
Raj, anything to add there?
Yeah, just very, very quickly, when we look at the kind of overall sort of psychographic landscape of people who are hesitant, I would say they generally fall into 3 categories. There are people who have, these kind of reasonable, and I think legitimate, concerns around safety, around efficacy, particular use cases, for example, pregnancy, autoimmune disease, things like that. Those are things that you can deal, broadly with just information. And then the second group, I would say, is sort of the more sort of skeptical group, right? So those are, where you have, potentially vulnerable populations. I think this is actually really, really important too, because in many cases, and we're seeing this in the United States, and certainly it's likely true in Canada as well, where there are populations like, for example, urban Black populations in who disproportionately suffer from the effects, both the economic as well as health impacts of the virus. And have a lot of skepticism, and their skepticism is rooted in anything from historical injustices to bad experiences, for example, with the healthcare system, lack of access, for example. That's a huge issue for a lot of people. And then, issues around, religious faith, for example. You can imagine, there was a report that came out of the UK around Muslim populations wondering whether it was halal to take vaccines. So, these are all kinds of things. And then the last piece, of course, is around, complete skepticism because QAnon, blah, 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 which is, it's easy to kind of say that's not a big thing, but unfortunately it's a huge thing. And as Josh said, it has to be dealt with, right away. So there is a constellation. There's no one size fits all. So the fact that you have to be able to kind of segregate and figure out who these people are, as Angel said, and then specifically target messages that, hit very specific psychographic elements, that's the way to kind of, get your message across.
Great, thank you. And Scott, I saw you nodding there. Any thoughts on the how?
Yes, well, absolutely. And, frankly, that's where we've been thinking quite a bit of what we could do with Convince. And we put together business partners to Convince. And business partners very specifically have put together a global COVID-19 workplace challenge. And this challenge would be that companies can sign up and engage in a meaningful way. So they can listen to their employees' needs and concerns. They can put forward not only the public health measures, but measures in the workplace. They will be able to sign on to promote the best scientific evidence, to encourage vaccine competence, to build vaccine literacy, advocate, as we just talked about, equity, fair, accessible vaccination, and establish partnerships. And we think just by putting these basic tools together, that will help businesses put a forward-facing and proactive place in society. The other piece is this is not just based upon a nice thing to do in a campaign. It's also based on strong, solid evidence that we've seen the employer as the trustworthy source. In Canada, 59% of Canadians, when we did our study over the summer, said that they would trust their employer's recommendation to take a vaccine. That's even higher than if it were mandated that the employer would need to. So we need to think about these voluntary incentive-based measures that we could really move forward that are using whether behavioral economic approaches, but also the incentives that all of us in the business community are interested in innovation. And let me just use one other last quote. As I mentioned passion before, the other piece that's quite interesting is if you think about what James Fenimore Cooper said early 19th century, they say is the monarch of the country. And he said, they say, no one asks who says it as long as people believe that they say it. And how do we create the obvious reality that COVID is killing people, that there are easy solutions, relatively easy, and also economically feasible with vaccines. We've got to figure out ways the they becomes this big social norm. And I think that's the piece of what Raj is talking about, from a small segmentation to the big they say. And then hopefully we get to that community immunity and herd immunity that was established and discussed earlier by your sponsors. So I'm looking forward to getting the business community engaged with Convince.
Thank you. So you teed up my next question, Scott, which is, are businesses and also other non-healthcare organizations like NGOs and others stepping up? Is there a critical mass sort of gathering to join the effort? Are they finding ways to do this, or is the jury still out on that?
Well, I think, thank the Empire Club for this opportunity. I think we need to do this multi-sectorally. Part of the problems are because there are silos. Frankly, some people, and I'm a believer in government as well. Some of these ought to be, government-led partnerships, or at least supported. Certainly the governments have been buying the vaccines, distributing, and hopefully soon enough getting vaccines to become vaccinations, meaning they're in people. So I think that there's an important component there. I'm starting to see some of these groups step up and think about campaigns, but as Raj was saying, we don't want to get ahead of a campaign that builds demand and then you don't have the appropriate supply, so you get the anxiety that the system's not working and less trust in government. So Ja's point on the government and the medical establishment and the scientific community and the social media Facebook groups of docs and others, those we need to fan out. So I would say it's early. unfortunately, I would also like to say it's getting late. So let's foster with Convince 19-0. Partnerships across borders. The microbe goes across borders. We need to have our multi-sectoral partnership across that, and that's why we welcome everybody with Convince. And I'm appreciate again the time today to share these ideas with you, Bill.
Thank you, Ja. Do you have any thoughts on businesses and other non-healthcare orgs jumping in? Are you seeing it happening? Do you have thoughts on what needs to happen to bring them in?
Yeah, no, I definitely. I mean, and I have this other job with the Cleveland Clinic Canada where we actually provide, a lot of Canada's bigger companies advice on COVID vaccine. And, I think that in that role, like many companies actually are leaders in this space in the sense that they recognize a problem, and that, it started with contact tracing and then testing and now vaccine. And I think there's, first of all, a ton of stuff that companies as well as any sort of organization society can do. I think that what needs to be done to sort of further engage them, one is really like information is quite critical. Like, and that sounds really blasé, but I mean, I think right now, very few people know with any detail that let's say the planned rollout of vaccine, like in Ontario, in Alberta, in Canada, right? And so having some like planning on that is helpful. Yeah, there's some of the science pieces too that people probably need a bit of help with. But I think that by providing, showing like a little bit of a path forward to these organizations, they will take the initiative. And I think that just with the Scott's comment on like not racing ahead, like I will say this, right? Like we're not going to tell people to go rush their pharmacies today. But I think one criticism of our entire approach to COVID, and I'll say that as somebody in public health who's been pretty involved in all of it, has been why aren't we planning ahead? Or why aren't we thinking ahead? And now we have sort of at least in Canada, we have a few months to do that. And so I think it's definitely not too early to start thinking about these and planning quite actively around, getting employees, other constituents vaccinated. And there's a huge role, and we provide a lot of support, I guess. And so we do need everyone on board.
Great, thank you. Our next question, I'm going to direct this to you first, Raj, because you're such an expert on both the data and what's effective messaging and what's ineffective. Are we losing out currently, would you say, in the big picture to misinformation in the social media space? We know that's happening to some extent beyond the vaccine, but particularly thinking about the vaccine, is it having a negative impact, and what can we do about it?
Yeah, I think we are losing out. And, again, as I said, there's, this discussion that we're having, unfortunately, is something that should have been had a long time ago. So, I'm going to be a little blunt and say that, it is early days, but I don't see, business and quite frankly, many people stepping up to this at all. And I'm saying this because, in the organization that we started, it was really sort of a grassroots movement, and we did it because no one was doing it. And there was a massive gap. People weren't recognizing that this is a really emergent and dangerous problem. This is why we jumped in. It's not like, I work on COVID 24 hours a day, or even vaccines. These guys do, but I certainly don't. But the reason we started this is because there's a massive information asymmetry, and largely it's coming from social media and other places where the interesting thing about social media is it's very, very good at creating emotional responses. In fact, all the platforms are designed based on emotion. They're not designed to give clear information to people. They're designed to provoke people, and generally in a negative way. And so that's what, certainly that's the case. And, it's interesting because we're in a situation where we have this massive crisis, everybody knows. And we also aren't mandating people to get it. So the government isn't coming in and saying, okay, everybody has to get it. And there are a wide variety of reasons why that's the case. And that's not to say that there aren't mandates. There are a complex sort of regulatory landscape. For example, if you want to travel abroad, if you want to potentially go to work, maybe workplace will mandate, but it's certainly not a national mandate. So in the absence of a mandate, if it's based on volunteerism, it's astonishing to me that there isn't a big national push to drive people to get, so for any other product in the world, if it's a computer or a new phone or whatever, there's a whole market shaping exercise. Ferris probably knows this very well because it's true in pharmaceuticals. I have worked in pharma for many, many years prior to this. You shape the market for the drug so that it kind of lubricates the entry of the drug into the world. For some reason, that has not happened in this case. And you're combating the complex regulatory and scientific landscape at the same time, where people are, concerned about these sorts of things, but there's no single trusted source of information that is multi-sector, so that if you're a Canadian, you can see yourself within some organization representing your interests, telling people the truth about vaccination. It is absolutely critical that this happens. And so, just a short answer to your question is, it's a huge problem from the social media perspective, and we are not addressing it, I don't think, in a very effective way.
Thank you. And Ja, you wanted to add something there?
Yeah, no, I totally agree with Raj, right? I mean, I think that there's all these memes floating around, like Canada will spend billions of dollars sourcing vaccine. It's a great thing. I often joke, I think if the collective provincial and federal government spent, half of Coca-Cola's annual ad campaign on vaccine uptake in COVID this year, that'd be great. And I think I say that as somebody who works for a public health organization, somebody who works for multiple ministries. And, I think that this is not to criticize government actually in a way, because I think there's not a whole lot of point in doing that. What we need is just to get the right solutions out there. And so one, we always work with government and public health and whatnot, I'm of both, but two, we really do need more around uptake, right? We need better campaigns. We need, better interventions on social media. And I think that this is an interesting piece to say. I think there has been a lot of criticism of government for various things. And I'm always happy to be criticized. But I think that, there is an opportunity for people to step in. We can shift the discourse collectively actually around, fund some campaigns, do some stuff on social media. Everybody can pitch in to do that. It sounds maybe a bit weird to do. But I think there are avenues for us to, for people who maybe seem a bit outside of the system, to actually play a pretty strong role in increasing uptake. And so that's all I wanted to say.
Thank you. Just on the social media front, just a little note of hopefulness I would throw in here is that with all the misinformation and disinformation floating around, COVID-19 and vaccines are having a really big impact in a positive way on science and research of detecting disinformation, misinformation, and also of narrative detection generally. I mean, we are making massive advances in that field, I know, because my organization is doing this. And I think that, come some future event, God forbid it's another pandemic, but something where these issues are front and center as they are now, we will have better tools to address them. So with that said, I want to share the first audience question for our panel. This comes from Sarah. And the question is there a risk that all this effort and energy to deliver on the COVID-19 vaccines means we are taking our eye off the need for other pediatric and adult immunizations? And I wonder if maybe Angel, you could speak to that?
Yeah, absolutely. That is a fantastic question, Sarah. Thank you for that. It highlights one of, a bigger picture, absolutely, where because of all of the shutdowns and because of, restrictions and access to healthcare systems, adult and pediatric immunizations have fallen down dramatically. I think some polls in the States, in the US, has looked at that. And, in some states in the US, pediatric immunization rates have fallen 50, 60, 70%. And that means that, we are at risk of a society and as a population of having resurgence of vaccine preventable diseases that were in some cases eradicated or near elimination. I mean, we've seen that, once we have high population uptake of vaccines, that causes herd immunity or community protection. Things like measles vaccines, we need to have 95% vaccine uptake to have that herd protection. And once we fall below that threshold, it allows the entire population to then be susceptible and puts all of us in danger and at risk. So unfortunately, we know in some of these third world countries or resource poor settings, not only in first world countries, but a lot of these resource poor settings, that immunization programs have fallen down to a near halt because of COVID. And so, we unfortunately as a society, we need to brace and expect that we are going to see these resurgence of diseases, which is a tragedy because we have made so much progress, and vaccines really throughout the last 40, 50 years are one of the best health prevention tools and have saved more lives globally than any other public health intervention.
Thank you. And John, do you have a thought on that? And then I'd like to ask Scott after you. Yep.
Yeah, no, thanks for that, Angel. So sort of in the pre-COVID world, me and Angel work on sort of addressing like getting vaccine rates up in general. And she's right? Like they're like for like two main reasons, like vaccine uptake for all the regular stuff is decreased. One is, like the lesser reason is I think people are often scared to maybe see their doctor. We saw a lot of that in the first wave of the pandemic. The other, bigger reason actually is that access has been limited, right? Because a lot of offices closed, public health got busy. And so, yeah, we will see the lowest rates of vaccine uptake like ever for routine childhood vaccines. And that's a problem. And that's a problem that, we are working on actually. But I think that I view this as sort of like, it's a great problem, but there is a potential silver lining to this, right? As I was saying earlier, before COVID, like we didn't really know, we had no real like good strategies to address vaccine hesitancy, frankly, and other than, telling your doctor to recommend it. But now there is so much effort being put into like vaccines and fighting misinformation. And what we are learning from COVID, the things we're building, like we will use for other vaccines in the future. We need to catch up quite quickly, and that requires system change. But after that, I think just the spotlight on the importance of vaccines, right? Like without a vaccine for COVID, we would be completely screwed. And it just, again, highlights how important they are. A lot of the times I think we don't think about MMR measles vaccine as much because we just don't see a whole lot of it, which is a good thing. And I do think that, through this process, we'll solve the COVID thing, hopefully, and those tools will help us solve vaccine hesitancy writ large in Canada and globally. So.
Thank you. Scott, anything to add on this balancing between COVID and everything else?
Yes, all I would say is, as I mentioned at the outset, we've been looking at the idea of vaccine literacy, and this was originally in Harvard Business Review. And we later wrote about our business partners to convince, also again in Harvard Business Review, of that kind of engagement that's necessary. Vaccine literacy also means that people need to get their seasonal flu vaccine if they're an adult, and to take care of their family for children. The COVID vaccine crisis does give us an opportunity, but at the same time, we need to figure out ways of having these consistent messages that go across all levels of society and also embed this with employers. Let me just say the last thing is, whilst I was at Harvard for that year, we wrote an article in the Washington Post very specifically on childhood vaccination and the need in that time for the federal government to engage more than the states. It may be something similar also in Canada, to think of the federal government versus the provinces, of who has the role for the vaccination and who has the role for the procurement. And that's why this whole idea of public-private partnerships and having multiple sectors making the decisions together are the ways that we're going to get out of this. And hopefully what Raj was saying, it's not too late, but it's certainly something that we're poised to do with those of us who are involved with Convince and your initiatives here.
Thank you. So I have a question that is refers somewhat to a remark you made, Raj, and it's also based on my being an American based in the US. Here, Black and Native Americans are not only vaccine hesitant, but have very good historical reasons for not trusting the government when it comes to matters of health and medicine. So it's very different from people believing falsehoods and so forth. This is historical facts that are passed down in families and that are very powerful for people. Are Canadian public health agencies facing similar problems with Indigenous populations and other minority groups? Is there a similar challenge here? I would offer that to anybody if you want to raise your hand.
Yep, definitely, I would say. And so, certainly one thing I think that the public health groups in Canada, public health agencies of Canada, really do hone in on, and it's a good thing, is just sort of, issues of vaccine hesitancy in vulnerable populations, right? So we have some data, like in Toronto, we did a survey, showed, I think, Black Torontonians were 10 to 50% less likely to want vaccine than the general public. newcomers were also about 10% less likely. And, you think about in Canada, we've had some pretty big outbreaks in that population in Southwestern Ontario and those greenhouses, the Cargill meat plant, which is North America's largest. And I think that, again, I'm using the word trust. It really, if you've had reason to mistrust government before, and I think, Indigenous populations probably have the most, then, that trust has to be rebuilt. And, I think that quite a lot of work in this space, always with organizations that have been working that space. And I think that, the approach that I think is the best, and Raj should comment on some of the work that we're doing in Montgomery, Alabama, but it's got to meet people where they are. And so generally we don't start with saying get vaccinated. Generally the challenges people face if you're racialized or lower income is if I get COVID, I won't have sick leave, so I may go to work. So, it's what can I do? How do I get the food when I'm being told that mandated to isolate from public health? How do I pay the bills? And so, that I think is part of the trust building process, right? And I think that, that is beyond critical, right? And not only are vaccine, uptake are lower in this population, they're also way disproportionately affected, a double-edged sword. And so it's a big problem here. Maybe the US is slightly bigger, I'm not totally sure. Big problem, and we gotta face it head on. So
thank you. Raj, are you seeing that? We have one of the partners in my organization, the Center for Constructive Communication at MIT, is doing conversations on the ground in Atlanta about vaccines, and they get their richest information from literally gathering people in small groups to talk about these issues. Are you seeing that in your work?
Yeah, we are actually doing that and community engagement. So just going back, Canada, we like to think of ourselves as a very egalitarian society. In many ways we are, but the fact is that issues of systemic racism and health access are huge issues in Canada, particularly among First Nations populations. And it's something that, it has to be addressed, and it hasn't historically been addressed. That's what's so fascinating about COVID, is that it's really kind of laid bare a lot of the complex societal issues that exist. And again, it's a great opportunity to begin to build, partnerships that could have, historic implications. And I do think, championing, community leaders, I think, is a really key issue. It's engaging, understanding what issues are, and then having community leaders as advocates and champions for the cause of vaccination is a critical way to kind of proceed. It's something Jai has been involved in doing this. I'm sure Angel has been doing this as well. Like this, these are the kinds of really, really important efforts that are going to, potentially, move the needle significantly, particularly, again, with First Nations, with newcomers, and Black and Latin populations, for example, in the United States.
Great, thank you. So the audience has been amazing. We have, I think, now over 40 questions, which we won't be able to get to most of, but thank you everyone for participating and interacting with us. So I am going to try and get to it. Two more. The first one is from Judy, and Judy asks, does the message change between different demographics? For example, how do we convince millennials and baby boomers for the importance of vaccines specifically? Raj, that's sort of on a platter for you, I think, if you want to start.
Yeah, it definitely does change. Yeah, and it's interesting. We have a national television campaign. Some of you may have seen it. I know it's running in Ontario. It's running in British Columbia, Alberta, and I believe Manitoba. It's called COVID is a Bear. It's really kind of hitting this concern index that Scott was talking about earlier, trying to get people who are generally not interested to become interested. And it's kind of it's a somewhat silly spot in a way. It's basically kind of sort of comparing COVID to a potential bear attack, but it has stopping power. It's really, you can watch it, and it's both funny and kind of alarming at the same time. But it definitely, you have to segregate audiences, and you have to get the right message to the right people at the right time. That is the kind of, as I said, it is this sort of general axiom of advertising, reach and frequency, that you want to get it to the right person, the right place, at the right time. And unfortunately, just we haven't been able to scale it as yet for funding reasons, but it is really important that this happens, and it is certainly achievable. It's something that we can do, and there is a methodology and a science behind it, and it works. That's why companies use advertising all the time, because it's effective. So absolutely.
I'm curious if doctors down on the ground, like Angel, you doing, people working for you, seeing patients, do they tune the messaging based on however much information they have about the person's generation, all these different questions? And is that part of I know you don't have much time for training these days, but is that something you work with your physicians on?
Yes, absolutely. And that's really where the science and the evidence is strongly suggestive of different messaging targeted towards different groups. And that's more of an effective communication strategy when it comes to vaccine uptake. And we find that if we personalize that message, if we kind of, direct our message towards that person's individual situation, say, for example, that, 20-year-old may have a grandparent that they live with or look after, well, that message changes towards not, you may be 20 and you may be fine with COVID, but your elderly grandparents may not be so, they may not do so well if they get COVID. So that would be an additional reason why that 20-year-old will then get vaccinated. Same thing, new circumstances. They may have family members that have different health conditions, or they may have young children at home, or they can't take time off work, as Jean mentioned. So absolutely, personalizing that message leads to a significantly higher vaccine uptake.
So this is a question related to that from Heather, another audience question, who asked, if people's beliefs about vaccines are tied up in emotional and social roots, does going to the data and science, using the data and science, is that effective? Does that persuade them? Or is it, she didn't ask this, but I'm adding, is it a mix of the two somehow?
Mm-hmm.
It's like,
sorry, go ahead, Scott.
I was just going to be very, very simplify. I think Raj said the right importance on the message, but it's not always message, it's the dosage. And the dosage has to be at the right time, whether it's in the clinical encounter, in the middle of a sports event that you're watching, talking to friends. And that's why this vaccine literacy piece gives the frame that you're giving people the knowledge and the ability, or helping them get that educationally, but simplifying the system. So if they're going to a supermarket, they may be able to get their vaccine there. Or if they're not ready to get a vaccine yet, they're getting a message that will be the right thing to do for themselves and the family the next time they're there. When they're going back to the workplace, that they know they have the measures that are in place to protect them if they're not vaccinated yet, and they're going to make it easier for them to get vaccinated. All these pieces, conditions of travel and so forth. So right message, right dosage in a way, and all of us are engaged. And I'm hopeful that can happen still. So that's what our convinced piece is about.
Terrific. Thank you very much. So we're going to wrap up here. I think I'm going to be presenting the poll results, but I don't have those yet. Let's see if they come up on my screen here. No, I don't have those yet.
It's on the screen, actually, Bill.
Oh, wait a minute. Okay, sorry.
Seems that roughly 3/4 of people definitely have a friend or a colleague who are hesitant, which is, again, consistent with all the kind of information that we've seen.
Oh yeah, there it is. Sorry, I didn't have my view on correctly. So do you have a family member, friend, or colleague who's hesitant about vaccines? For anyone who can't see this, 72% yes. Wow. 28% no. That is, are we surprised, panelists, about those numbers? No. Yeah, I have to say I would have had to answer yes as well. Yeah. So, well, with that, I want to thank all of you for the wonderful conversation and amazing expertise and thoughts you brought to this. And I've learned a lot. I hope that our attendees have learned a lot. Thank you all for being here. Thank you again to the Empire Club, and Faris, to your company for hosting. And I'll hand off to Antoinette.
Thank you. That was an amazing discussion. Like, wow, makes you wonder how we're going to get everybody vaccinated. But I'm going to turn this over now to Dr. Tom Stelfox, who's the director of the O'Brien Institute for Public Health at the University of Calgary, to deliver the appreciation.
Thank you, Antoinette. Good afternoon. My name is Tom Stelfox. As Scientific Director of the O'Brien Institute for Public Health at the University of Calgary, I'd like to thank the Empire Club for hosting today's important discussion about vaccine hesitancy, convincing Canadians of the importance of vaccines. Just over a year ago, the world had never heard of the coronavirus and knew nothing about COVID-19. In the subsequent year, scientists from the O'Brien Institute for Public Health and other organizations around the world have pivoted and mobilized at breakneck speed to explore every aspect and characteristic of this virus and disease, how it spreads, how it affects us, how to treat it, and how to defeat it. This information has been used by public health professionals to inform and implement everything from restrictions and treatment protocols to safety measures and vaccination strategies. This science is impacting the health and well-being of people in every corner of the world. With the prospect of vaccination comes both hopes and challenges. I can tell you from a personal perspective that as an ICU physician, I've already been vaccinated. This is an incredible privilege when most people are still waiting. So how do we extend COVID-19 vaccination to the world's population and convince people to take this opportunity? Well, I think today, Drs. Chu, Hu, Pannu, and Ratzan have shown us how to think about managing vaccine hesitancy, which is key to a successful vaccination campaign. As a global community, we've done this in the past with polio and smallpox. Now we need to do it for COVID-19. Thank you.
Thank you, Tom. We had a lot of questions coming in today, more than Bill could keep up with. And I think I've seen through the notes going in the background, Bill, that we have volunteers here on the panel who will answer the questions. And I'm just wondering if that is the case, maybe we can even post them online, because it would be great to share those questions and answers. So if you're all good with that, I would like to make that announcement for our audience, because lots of questions, I will tell you, which is great. So thank you for that. I really appreciate that.
Where will they be posted, Internet?
We can post it.
Okay.
We can post it on the event, and
okay.
Or we'll send it to everybody who attended. So I will coordinate with our office, but I think we can post it on the site.
Terrific.
So,
Great. Yeah.
All right. Well, thank you again. This was amazing. Bill, you did a terrific job moderating, and everybody on the panel, thank you. It's a very heavy topic and a very important topic, and I'm so happy that you were able to come to the Empire Club to share your findings, your thoughts, your insights, your guidance, your etc. on all of this. I'm just going to close with letting people know about our upcoming events. We've got Angel Gurria, who's the Secretary General of the OECD, coming to talk about how Canada can build back better. And it's obviously from OECD's perspective and their advice. On the 25th, we've got Black music and its influence on North American music. And we've got an amazing panel with Julie Black, Dan Hill, Molly Johnson, Ron Westray, and Rudy Blair will be chairing that panel. On March 8th, we've got Women Who Lead, celebrating International Women's Day, featuring the first woman to lead a major Canadian bank, and that's Rania Llewellyn, who is president and CEO of the Laurentian Bank of Canada. And she will be having a fireside chat with Jennifer Reynolds, who's the president and CEO of Toronto Finance International. Registration for all these events is free. I want to thank everybody for joining us today. And again, thank you to our panel. And this meeting is now adjourned.
Thanks, Antoinette. Thank you.
Thank you.